on the run or whatever you managed to do. Sharushka, we're waiting for Subrata. Are you here, Subrata?
I'm just getting here. Yeah, perfect.
Excellent. Okay. So welcome back. We've got three speakers this afternoon in a session entitled Funding and Implementation of Cross-Institutional Research. And Sharushka, would you like to say something about the aim of this session?
Sure. So welcome back, everybody, after lunch. So we've had a great morning so far, talking about the various projects across the country focused on immuno-oncology and the microbiome. And the focus of this current session is how we pull it all together through funding mechanisms, through working with institutions and other key stakeholders, including incorporating the patient voice to make sure that our work is relevant, holistic, and brings all the key voices to the fore. So in order to foster this session, we're going to have a talk from Seamus Brown, who is at the Beaumont RCSI Cancer Centre within RCSI, can talk to us a bit about funding mechanisms and industry partnerships, followed by Claire Kilty, who's going to talk to us from the Irish Cancer Society, and then Seamus Carter, a patient advocate. So without further ado, I'll hand it over to you, Seamus.
Okay, well, good afternoon, everybody. And just to check that everybody can just see my slides and hear me. Great. Okay, thanks very much. Okay, so Seamus Brown is my name. I'm Head of Strategic Research Initiatives and Industry Partnerships at RCSI. And I've been working at the interface between industry and academia for probably the last 20 years, a little bit more, in fact, actually. Very briefly, I'm sure most people on the call today are familiar with RCSI, but for those that aren't, it's an independent non-for-profit university founded in 1784, sole provider of surgical training in Ireland, the academic partner to 7 hospitals in the RCSI hospital group, and I guess renowned for producing high-quality publications as evidenced by our field-weighted citation index. An international university with 4 overseas campuses. As I said, we are an independent institution. We receive about 15 to 16% of our funding from the state, and we've invested progressively and aggressively in our infrastructure, both on campus and in our affiliated hospital sites. One of the things that's really relevant to the call today is the growth in innovation activity in RCSI over the last 6 years. Where 75% of our research PIs are now innovation active, and where we've seen an increase of 400% in industry partnerships and a 6-fold increase in research commercialization agreements. We are a very collaborative institution, a relatively small institution, exclusively focused on improving human health. And we do have a long track record of engaging and collaborating with many of the institutions that are represented on the call today. And just to maybe highlight 3 of them, Precision Oncology Ireland obviously has been referenced throughout the morning. Liam also mentioned the HEA North-South call and the success that AICRI had in that. And also, I guess, Cancer Trials Ireland has been mentioned this morning, and RCSI is the host institution for Cancer Trials Ireland under the new round of HRB-funded Cancer Cluster and Network Awards that were issued just before Christmas. Sharushka mentioned the Beaumont RCSI Cancer Centre, and just to touch on that a little, is 4 years ago, we commenced an initiative to establish, in partnership with Beaumont Hospital and St. Luke's Radiation Oncology Network, the Beaumont RCSI Cancer Research Centre. And a key part of this was to seek OECI accreditation for this centre. A phenomenal amount of work, I would say, went into this, led by Patrick Morris and Leonie Young, and indeed many others from both across RCSI, Beaumont Hospital and St. Luke's. A true collaborative effort, I've got to say, that really helped to break down the traditional boundaries that may exist between translational lab-based researchers and clinical researchers. And also, I guess, an initiative that really helped to, I guess, focus on the significance and synergy between excellence in clinical service, research and education in terms of improving patient outcomes. Recruitment of key talent to Beaumont and RCSI is critically important. Obviously, thrilled to have Jarushka to come back, and with her expertise in immuno-oncology, to have that in Beaumont, and certainly in terms of helping advance some of the discussions that we've had this morning. So I guess the focus of the talk today is really to talk around industry partnerships and how they can provide some momentum and support for what it is that we're hoping to achieve in AICRI. And just to start off with trying to, I guess, remind ourselves of why it's worth partnering with industry. And I think everybody on the call, just looking across many of the participants in the call today, to some degree, it's probably like preaching to the choir. Many of the participants in the call today have got very active collaborations with industry partnerships, and you don't necessarily need me to tell you why it's worth doing. But I think it is always useful to remind us that industry partnerships provide us with a channel to translate our research results into impact. It provides access to new diagnostics, therapeutics, and devices that can improve patient care and outcomes. It's obviously a source of funding for translational clinical research, and that's relevant very much to today's discussion. And it can help increase our reputation and relevance of our programs. So I don't think there's anybody on the call today who would say that they're not interested in increasing the impact of their research. And equally, I don't think there's anybody on the call today that would feel that patients can't benefit from better diagnostics, therapeutics, devices, and health service delivery. And I guess industry is a key component of enabling that vision to happen. So I guess the flip side of the coin then is to, as in every good partnership, is to try and understand it from the other person's perspective, and why does industry want to partner with us? And I think if we can think of this framework, it helps us organize how we present ourselves out to industry, how we capitalize or articulate what our key value is. So if we just start and look at the life cycle of a new diagnostic, therapeutic, or device, it can be broadly broken down into what I would say 5 phases. And the first phase of that is idea generation, generally followed by preclinical validation, subsequently then clinical validation, market launch, and post-market launch activities that would happen. So from an industry perspective, that's generally how they would look at product life cycle. And if you think of the different phases across those different phases of product life cycle, companies generally have a need where during idea generation, preclinical validation, and clinical validation, they need to access translational and clinical research expertise. When they're bringing a product to market, they're interested in market access capability, and that's really around trying to engage with key opinion leaders. And then once a product is out in the market, they're interested in generating real-world data off that product and ideas around life cycle extension for that product. And what we find is that companies are interested in collaborating with researchers and universities and hospitals across all of the 5 phases of the product life cycle. And if many of the presenters earlier this morning actually did a fantastic job of calling this out, is the value add that we can bring to not just our academic collaborations, but also our collaborations with industry. And if you think around, say, the value contributions we can make, it's around IP and know-how, particularly in that idea generation phase. In the preclinical validation phase, access to preclinical models or patient-derived models is often sought by industry. And then when we get into clinical validation, having good, well-characterized, research-engaged patient cohorts is something that industry are really interested in accessing. As a product goes to market, they're interested in maintaining and progressing relationships with key opinion leaders. And when a product is out in the market, they're obviously interested in new product applications that can drive life cycle extension. So I guess what I think is great to see listening to some of the talks this morning is that, you know, if we're going out to try and pitch to industry, looking for funding for them to advance AICRI's interests in I guess, immuno-oncology and the microbiome, being able to highlight exactly what we're bringing to the table in terms of IP, preclinical models, patient cohorts, and key opinion leader relationships is critical. Once again, I probably don't need to emphasize this to many on the call, but hospitals, universities, and industry obviously have very different missions. And successful partnerships, and in my experiences, are built on aligning interest on the academic clinical side with company need and available funding. And that's that little bit in the middle in the diagram that I've represented, what I call the sweet spot. And it's critically important to build trust across the different communities. But I think we always have to focus on getting to that sweet spot, because it's only then that you get successful, impactful partnerships that can really move the dial in what it is we're trying to do in terms of patient care. Some superb funding programs in Ireland to support industry collaboration, and I haven't mentioned here any of the programs that are there to support academic or academic clinician collaboration. But what I would say is there's a phenomenal number of programs out there. Ireland is often being remarked to me by many industry of having perhaps one of the best array of mechanisms for engaging with companies. And the challenge is often, I guess, coming up with that alignment of interest and need, which is obviously the key bit. And generally, I guess, if you've got good company support and good, motivated, high-quality academics behind the concept, it tends to find funding. Briefly, we talk about, or I think about funding programs for industry collaboration as those that are market informed. They're programs that are typically fully funded by the state, but having strong industry partnerships enable your application to those programs to be more successful, and because the funder would often deem them to be more relevant. And then as we move from left to right, as you look at the screen, into industry collaborative programs, these are programs that are typically co-funded between the state and industry. And they include programs like the Innovation Partnership Program, the Strategic Partnership Program, the SFI Research Centres programs, the SFI Spoke Program, and then some of the lower value programs, but are still worth considering, like the Industry Fellowship Program for movement of talent, and IRC Enterprise Partnership Programs for the generation of PhD, MSc, and postdoctoral researchers. And then at the far right, we've got industry fully funded programs. That's contract research, consultancy, infrastructure use, company-sponsored clinical trials, investigator-initiated studies, and indeed educational grants that companies are often very generous in providing. Obviously, a whole range of European funding programs out there. It's impossible in the time we have to go through each one of them in detail, but everybody on the call, I'm sure, will be aware of the Cancer Mission in Europe and the focus that's on that. And I think kind of what's important to point out is that some of the key differences at a European level have been the focus on cancer survivorship, and indeed the incorporation of existing research output into practice. And I guess that's something that I think that we need to bear in mind in seeking European funding, is that we're aware of those subtle but significant changes at a European funding policy level. So I guess the topic of the call today, or the general workshop, is around immuno-oncology and the microbiome. And I guess I often look at things from, I guess, the relevance to industry and indeed the market growth rates that are predicted. And once again, it's probably very clear to Paul and others on the call that there's phenomenal interest in industry for immuno-oncology drug development. And the microbiome market is expected to grow significantly at a compound annual growth rate of about 7, nearly 8%. And when you look at the market segmentation analysis for the human microbiome, you see that cancer is actually a significant and growing proportion of it. So certainly interesting to hear, I guess the thoughts that were expressed earlier on this morning, that it is maybe 10 years ago, it wouldn't have been considered that microbiome and cancer researchers would come together on a call. Looking at some of the data that's out there from a market research perspective and an industry trend perspective, I would say now is the time for us to come together, because I think there's a great opportunity here to capitalize on. Many on the call will be aware of the phenomenal growth that's there in immuno-oncology drugs. Worth probably by the end of this year around 70 billion, having grown about 17% in the last year, and expected to reach a whopping 120 billion by 2026, with a phenomenal growth rate of 14.3%. And I guess, once again, many of you will be aware of the phenomenal amount of drugs that are in both preclinical and phase 1, phase 2 development, phase 3 development that are coming down the track. I've called out some of the companies here that are very active in the immuno-oncology space. And interestingly, many of these companies have got a significant manufacturing presence in Ireland. And I think that's important as we go to seek funding for engagement with companies. By the presence of these companies in Ireland, funders, national funders, are typically more interested in supporting programs that are aligned with their interests. I did mention that the kind of time is kind of now. We've discussed the phenomenal growth in immunotherapy. And I think it was one of our first speakers this morning touched on it there today as well. And I think in Paul's talk as well, it was mentioned that not all patients are going to respond to these potentially life-changing therapies. And, potentially the key that can increase the responsiveness of patients to immunotherapy lies in the microbiome. And there's certainly, I guess, in the trade literature, a shift in that direction. And I guess if we look to some of the significant kind of publications, these were 2 publications actually. I mentioned to a contact in industry about the talk today, and it was these 2 particular publications actually they highlighted. There's many other ones out there, but I thought the last one, the science paper there, I guess the quote there, that future strategies in precision medicine are likely to rely on novel diagnostics and therapeutic tools that can identify and correct defects in the microbiome that compromise therapeutic efficacy, was particularly relevant to today's call. And I think that what that gives me is confidence that there's a solid platform and basis to go out to industry and seek funding from them. So in terms of moving our engagement forward, and I think it is important, going back to that Venn diagram I spoke about at the start, that there is funding to move interest and enthusiasm forward. And for me, just thinking of the different mechanisms that are out there, the mechanism that strikes me as being the one that we should really try to focus in on and target is a SFI spoke application with the APC SFI Centre and the All Ireland Cancer Research Institute. That was focused on a programme of work that was looking at harnessing the microbiome to overcome or improve the efficacy of many of the immuno-oncology drugs that are in development. Many of you will be aware of the SFI Centre programme. It is, I guess, has been, and I think will continue certainly for the near future to be the flagship mechanism by which SFI fund much of their research programs. The SFI Spoke program allows for new projects to be linked in with those centres and combines and provides 50-50 funding between industry and indeed charitable or foundation and research foundation partners and Science Foundation Ireland. And these programs can be multi-million euro in nature. And it just strikes me, listening to some of the talks earlier today, that, and indeed looking at the trends in preparation for today's call that are evident in the marketplace, that with APC to advance this opportunity is something that could really continue to progress things and move it forward. Obviously, there's some, having gone through a number of these spoke applications in the past, and I know several on the call will have as well, there's some bits that need to be got right in terms of the relationship factors, the institutional factors, the framework and the outputs, the absorptive capacity of industry and the scientific excellence and relevance of the programme, But it does strike me that what we're dealing with here is something that can provide a significant market opportunity that's relevant to Ireland, that can build on existing SFI and indeed national investments and bring them together in a way that makes them greater than the sum of the parts, and ultimately give rise to significant societal and economic and indeed healthcare impact in Ireland. So just to finish up and to thank Jarushka and the organisers for the opportunity to speak today, and very happy to hang on and address and partake in the panel discussion at the end. Thanks very much.
Thanks, Seamus. Superb overview and a lot of food for thought, pun intended. From here, I think we'll go on to Claire Kilty, who's going to talk to us about the role of the Irish Cancer Society and other advocacy groups in supporting clinical research and opportunities such as this. Thank you, Claire.
Right, can you see my slides there, Jarushka? Yep, perfect. So thank you everyone for inviting me today, and it's really heartening to see everyone's great presentations and to see all the brilliant research that's happening in the areas. I am Claire Kilty. I'm the research manager in the Irish Cancer Society, and I'm coming today with kind of two sides of the coin. So I would have worked with Liam Gallagher in UCD for 3 or 4 years, specifically in the academic side of managing these cancer research grants. And then also I have worked now as research manager in the Irish Cancer Society for 4 years. So I kind of have the two sides of the coin, from the academic management of the grants, but then also from the charity perspective. So I thought today that I would focus on kind of some of our own specific priorities in the Irish Cancer Society as a funder and a charity in terms of our research strategy, how these link in with AICRI, and some of the opportunities in, say, for example, Immuno-Oncology. So in 2020, we launched our ambitious organisational research strategy, and these are focusing on priorities that cover the entire cancer continuum, so from cancer prevention right through to palliative care. And I suppose in terms of the research department, in line with implementing these organisational priorities, we developed a 5-year research roadmap in 2020, which we launched, and really to try kind of, look at the emerging needs within all these 5 priorities. We decided that we would focus our research funding in 4 main areas. So in translational research, so funding those lab-based researchers. In clinical trials research, we are a prominent funder of Cancer Trials Ireland, and we give them over €1 million a year for clinical trials. Not just investigative medical product clinical trials, but also, we're really trying to highlight the importance of non-investigative medical product clinical trials as well. And then we have increased our focus over the course of this roadmap in survivorship research, and that really is, as I said, living well with cancer, but then also at the end of life and the palliative care setting. And then we also fund across the entire cancer continuum in these, what we call these strategic and specialised research areas. And these really are areas such as prioritising cancers with significant challenges, so cancers with unmet needs. And that's really, focusing on cancers with poor prognosis, cancers with poor treatment modalities, rare cancers, metastatic cancers. And that really is a focus for the Irish Cancer Society over the next 5 years, as well as, really looking to ensure that access for cancer treatments really is encompassing, those people from underrepresented and minority communities. It's really important for us. And then we've moved really into children's cancer as well in this strategy. So looking at, all across the cancer continuum at research involving children, adolescents and young adults. And then also we really want to fund innovative research that seeks to develop new tools and technologies. And, interestingly, what came out of our consultation when we were initially doing our organisational strategy was things like funding in next-gen sequencing, funding in liquid biopsies, funding in biobanking, and funding in immuno-oncology was specifically mentioned as well. So in terms of some of the key priorities from our patients emerging in terms of clinical research, some of them are obvious. So obviously patients want new and improved treatments that are efficacious for their cancer type. the management of adverse side effects. So for immuno-oncology, immune-related adverse events, the management of this, cost of drugs, direct costs and indirect costs of drugs. And then one that might be surprising is, they really want to be involved in making sure that the patient voice is front and center. So really, as well as these three core areas, ensuring that we fund research and we're doing research where involvement of people with cancer is front and center is absolutely key. So I just thought, in terms of kind of the topic of immuno-oncology, I would run through some of the dedicated research calls that we have funded since 2020, given that it was specifically called out in our organisational strategy. And so we submitted an immuno-oncology application to the Health Research Charities Ireland HRB call in 2020. For those of you who might be familiar, the Health Research Charities Ireland is a group where a lot of the medical charities in Ireland are part of, and every 2 years work with the Health Research Board to try to leverage funding from the HRB. So it allows charities to be able to fund something 50% and then get money from the HRB for another 50%. So it's a really effective way to get research funding and get more bang for our buck. So we decided that we would fund within immuno-oncology specifically, and these partnership calls really do lend themselves quite well for us to be able to fund in quite niche areas, because as a charity we tend to have our funding calls over quite a broad remit of areas. So while we didn't get through in this round, we ranked 11th and they only funded 10 in 2020. We did decide that immuno-oncology is really important. This was a really good application, and that we decided we got the money and we funded it ourselves. So this was a 300k grant with Lydia Lynch and Donald Brennan to look into the immune activators in ovarian cancer. And then again in 2022, because this model works really well, we decided that we would try to apply for the HRCI HRB call again this year. We're currently going through that application, but again, the real focus was those niche specialised areas, and we do have 2 applications going through which have an immuno-oncology focus. So fingers crossed they'll get funded as well. And then we fund immuno-oncology in lots of other different areas as well. So this is just highlights, you'll recognise Jerushka, and we're funding Jerushka some buyout time to focus specifically on her immunotherapy research, as well as a number of PhDs and scholarships. So that's just a flavour of some of the immuno-oncology research that we as a charity fund. So ultimately, how can we as a charity help encourage research within these areas? And really, we are a research funder as well as a charity, and we have a number of small scale research calls open every year. We focus on career development and career track awards a lot of the time, and we will fund all across these every single year. Our focus, and we've talked a little bit about this today, basic and translational science are really important, and we focus and we have career development tracks for our basic and translational scientists and our clinical scientists, but also we really want to build capacity as a charity for those nursing and allied health professionals. We really need more nursing and allied health professionals in cancer research in Ireland, and there's a severe lack of capacity. So as well as funding the career development of the kind of traditional scientists, we also fund the career development of those aspects. And I would really encourage, when you're thinking about research funding, as well as the basic and translational scientists, you're also thinking about those nurses and those allied health professionals that are doing very much patient-facing research. And then we have a lot of different projects and smaller scale awards, and this would be where we'd fund into those kind of niche areas. So as I said before, we have a dedicated immuno-oncology project, and then we fund things like underserved communities, projects on COVID-19, projects on health technologies, for example. So that's, I suppose, how we can help in terms of individual funding. And if anyone in AICRI have a topic such as immuno-oncology or the microbiome, this is an opportunity to maybe add on to a bigger collaboration, would be to apply for PhD funding or to apply for postdoc funding, for example. So in terms of kind of those larger scale collaborative cancer research programs and, how charities can be involved in those large programs. So we as a charity have a history of funding large scale collaborations. We funded Breast Predict. So, that really was the first example of a highly successful cross-institutional collaborative program in Ireland. It worked really well, and it really was very much patient-centered. And, obviously we're part of Precision Oncology Ireland with lots of different charities, and we're delighted to be involved in that. And we think it's really important as a charity to be involved in funding with other charities and industry partners as well as academia. And that, that trifecta is really important. And then more recently, our funding model has changed somewhat to working more in partnership with our research programs. So again, as I said, not only are we a funder, but we're also a stakeholder. And, you know, with the likes of, we fund a Women's Health Initiative, which is a large program focused on research around women's survivorship, as well as funding the majority stake of these programs. We also work in partnership with all the centres as well as other stakeholders. So for example, we work on this with the researchers, we work with the NCCP, we work with industry partners, we work with health social care professionals and patient advocates. We hold quarterly meetings, and I suppose this allows us to have much more dynamic research programs. So as a funder, we're not saying, right, this is the program that's funded and off you go. It's a much more of a dynamic situation, and it means that we can kind of adapt to any emerging needs that are required. So it has worked really well. And I do definitely think, and indeed for our charity anyway, we will definitely be looking to continue this type of model in future. So for example, with our survivorship flagship that we launched this year, and this one's really interesting because we've also opened this one up to allow funding into Northern Ireland, because obviously as a charity, we do identify that an all-Ireland approach is really important. We're also always willing to work in partnerships with other funding agencies. We do this quite a lot, and indeed with other researchers on grant applications. The key thing here is to give us as charities, you know, a lot of notice. We do need to have notice when we're going to be partnering on applications, or if another funding agency is interested in coming together and doing a bit of co-funding. Our budgets are quite rigid, and unfortunately they tend to be from year to year. So I will say if there is any opportunities and you're looking for us to get involved in, where there's, you know, potential for us to bring some budget in, you do need to let us know by kind of Q3 of a calendar year, because once our budgets are set, it's very difficult for us to change them. And I suppose that's kind of one of the key things that people find, that people come to us with a really good idea that we'd love to fund, but unfortunately our budgets are set. So just to bear that in mind. And I suppose I just wanted to highlight that while obviously us as a funding agency, there are contributions we can give from a budgetary perspective, we also have a lot of in-kind contributions that we can bring to the table. So, you know, we do have expertise on things like cancer advocacy, information development and services. That's really important to keep in mind. And we can always link, the research team can always link you guys in with anyone else in the Irish Cancer Society that you need. You know, we do kind of have the patient voice. We have an expertise in PPI. So we have a panel of 50 people affected by cancer that review all of our grants, that are involved in the decisions and partnerships of all of our research decisions internally. And, you know, we work very closely with that panel, and we work very closely with researchers who are looking to access that panel. And we do have an application form for that. So again, if you are really struggling with PPI and it's something that you're looking for expertise in, we're more than happy to help. And you just need to come to us, and we'll see what we can do. And again, just give us plenty of time. And then we also run a lot of training courses for our researchers. So, you know, we run courses in grant writing for early stage researchers. We run courses in communications. We run courses in mentorship, for example. So, you know, these are, you know, things that you can tap into if you want. You just need to approach us. And then, you know, a real strategic priority for us over the next number of years is really trying to actively support researchers with Horizon Europe. And we want to make sure that Irish researchers are being successful in Horizon Europe, not just the basic and translational, but as Seamus mentioned, also within the survivorship areas. So we will be looking to provide support in the form of training, but then also support in the form of small grants to help researchers in Horizon Europe. And I know immunotherapy was specifically called out. There is a call in immunotherapy in 2022. I know cancer research wasn't eligible, but they did say that there would be a call in relation to immunotherapy as part of the cancer mission. So I presume in the next couple of years there will be a dedicated call in that area. That would be important to have some Irish applicants in if we can. So that's, I suppose, it for me. Just a quick rundown, and I just want to say thank you so much for the opportunity.
Thank you, Claire. That was absolutely super, really educational, and a privilege to be funded by the Cancer Society myself. From here, handing over to my advocacy partner in crime, Seamus Cotter, and looking forward to his talk.
Thanks, Jeruska. So I know you've all seen a lot of slides today, so I'm just going to talk for a couple of minutes, and hopefully you might remember a little bit about what I say. So as Jeruska said, my name is Seamus Cotter. I'm from Ennis in County Clare. I'm delighted to get the opportunity to speak to you for a couple of minutes. And the reason that I'm here is that back in 2016, I was diagnosed with stage 4 lung cancer. I was extremely lucky to get access to a clinical trial that was happening in Galway University Hospital at that time. I'm too well aware that I'm one of the lucky ones, as just 8 months after beginning the 2 years of the trial, my CT scans showed no evidence of disease, and this has continued since. That's not to say that my journey wasn't without its difficult times. As with many treatments, the fatigue I felt in the first year was difficult to cope with. I required treatment for meningitis at one point, and at another point I needed treatment for both hyperthyroidism and soon afterwards hypothyroidism. The most significant side effect I now manage on a daily basis is that my adrenal gland stopped producing cortisol, the stress hormone. So I am now classed as adrenal insufficient or as having Addison's disease. It is important for everyone to recognize that just because you look well doesn't mean to say that you are not dealing with a significant long-term quality of life issue. So following my treatment, I accepted an invitation to join Cancer Trials Ireland Patient Consultant Committee, and from there have been privileged to work with various clinicians and researchers on a number of grants and proposals. And I have become very active in lung cancer advocacy. During this time, I was also very grateful to the International Association for the Study of Lung Cancer to be able to participate in their Patient Research Advocate Training Program called the Supportive Training for Advocates on Research and Science, or STARS. However, my most important achievement has been the setting up of the Irish lung cancer community, a support network for people impacted by lung cancer and their carers, which has been sadly missing in Ireland until now. As you all know, advances in cancer treatment have evolved dramatically over the past 10 to 15 years. And as a research advocate, I'm enthusiastic about helping research translate into meaningful outcomes for people with cancer and their families. I try to provide both a personal perspective and the perspective of the cancer patient community to help research focus on the questions most important to us. I would hope that patient involvement in research will become valued and integral part of everything from the get-go, that this will help to design studies and will extend lives and improve the quality of life of people with cancer. More and more funding bodies are insisting on a PPI element to their grants, and with the full involvement of patient advocates, it's obvious that when these are performing their reviews, the better applicants are receiving the funding. Remember that the patient involvement is a very distinct level. Patients being involved right from the concept of a project. Patient advocates should not just be brought in to rubber stamp a grant application, maybe just before its submission. The reason why I continue to enjoy playing my part in projects is that the people who I have worked with until now have brought me on board as a partner with an important voice, which they listen to, value, and act on. The National Cancer Strategy also states that one of its goals is to maximize patient involvement and emphasized that it was critical to the high quality cancer service. So we must work together as equal partners to ensure that this is achieved. Thank you very much.
Thanks, Seamus. That was great, and actually very nice to have a break from slides and to hear your story. Okay, so from here, I'll move on to opening a Q&A session where we can direct questions at our most recent speakers from this session, but also welcome any questions from the floor about the previous sessions that were placed in the chat.
And Subrat has hand up.
Sure, I can go in. That was a great session. Regarding the Irish Cancer Society, it is my understanding that the SFI Centre spoke criteria may have changed a little bit. I mean, and Seamus Brown may also comment on it. It is no longer restricted purely to industry, but can also take in contributions from charitable organizations or a mixture of the two to be a spoke. Now, I had dug into it a little bit, and I think some of the details are still need to come from SFI. Any comments on that, either Seamus or Claire or both?
Yeah, as far as I'm aware, they are changing it. It's something that we absolutely encourage. I mean, it's something that allowed us also be part of Precision Oncology Ireland with SFI changing their remit. So absolutely encourage charities to be allowed to be partners as part of the spoke. So I think it'll make for even more impactful research.
Yeah, briefly in that, I think SFI certainly have taken a more holistic perspective in terms of what they would account as matched funding coming in on spoke programs. Charitable or foundational funding is certainly eligible. They do like to see an industry component and participation. And what I would say also is that industry are also interested in seeing participation of patient representative groups in the program. So, you know, in an ideal world, it's not one or the other. I would say it's trying to combine both of them to come up with a pot of money that can have a significant impact in moving the dial in this area nationally and internationally.
Thank you for that.
I might ask a question next, actually, to Seamus and to Claire. So, Seamus, you touched on the role of patient public involvement, how this is obviously a very core part of several grant applications. Certainly, as someone who's just returning to Ireland after nearly 10 years in the US, this is new to me, but it's just been sort of structured in a different way. I'm used to working with patient advocates, but just in a different setting. What do you think, from your perspective, makes a good PPI section of a grant versus one that isn't a very strong section? Maybe I'll send that to Seamus first. Yeah.
I think it's usually quite obvious that when you're doing a grant review as a patient reviewer, that you can read that the patients have been involved at early stages of the project. It's better again if the patients are involved in even the concept being drawn up and how the research has been driven, in what direction it's been driven, and throughout the project plan that there's ongoing engagement with those patients.
Yeah, I agree with Seamus. I was going to say that it's very obvious. We see a lot of these and it's very obvious when some of the patient involvement can come across quite tokenistic, and it can come across quite tokenistic because 5 weeks before the grant is due, researchers suddenly be like, oh no, I need to have PPI involvement, and they kind of do it quite last minute. And it really is, you know, as a researcher, you should be building that relationship with your PPI contributors and patient advocates before there's any grant application in an ideal world. So, you know what your research program is, you know what your kind of key research focuses are in general, you know you're going to be applying for grants as part of being a researcher. So, you know, really starting to build that relationship at the start is really important so that you can have that meaningful involvement. And, you know, also linking in with your local resources. All the universities have PPI Ignite programs. We note and can tell when researchers haven't linked in to see what's already there in the existing resources. And then also just linking in with us and asking for help. It's okay, PPI is relatively new in Ireland. Everyone's starting off, people make mistakes, just once you learn from them, and if in doubt, just contact us and we can help you as much as we can.
I think Subrata's hand is up.
So I will just reinforce exactly what has been said by both Claire and by Seamus. I think it is probably kind of the 10 years I spent in Canada that kind of drove me in that direction. But I found it very useful to have a patient panel. I mean, I'm just putting together a patient panel in IBD, which is my main research interest area, and actually interact with the patient panel continually. You know, you have an interaction with them to discuss, develop your strategy, develop your plans, and then the grant application flows naturally from it, and you are able to say genuinely that the patient panels have been involved in developing the ideas, and even within the patient panel, that's the strength of what Claire has been saying. Different people have different expertises, and different people, and obviously genders and different disease phenotypes, so that with a large patient panel, you can draw upon the expertise of a smaller subgroup in order to drive the more critical phases of asking for grant, so that patients realize that, you know, it is everything is for them. You know, that's what we're doing it, and together with them.
I'll ask Seamus Brown a question. Seamus, I really enjoyed your overview of the ecosystem and the potential industry contacts in Ireland. And you pointed out that a lot of these have production footprints in Ireland already. In the context of an all-Ireland Cancer Research Institute, are there any obvious opportunities? Are there any tricks that we're missing, either within the context of a spoke or a completely new relationship? Do any of these have an all-Ireland element or a strong UK element that we could leverage?
Yeah, it's a good point. And in terms of the all-Ireland cancer, I guess, positioning, I think it's strong in some respects. Like if I think of, just say as an example, clinical trials, essentially being able to do clinical trials across two jurisdictions is seen as attractive from an industry perspective, and it does create some challenges. But equally, I think it is an area where, I guess, presenting it as an all-Ireland capability, but highlighting, I guess, how the expertise that's coming from the north can act as a beachhead to the UK, the broader UK market, I think is something that's attractive to industry for sure. In terms of companies in the north that we're missing, there's a couple that would certainly, I guess, kind of, just one or two up there, some big companies up there, obviously in the oncology space. I'd be honest, Paul, and say I'd need to go back and check exactly what's up the north that's not in the south. My gut is that we have a much more significant pharma manufacturing presence, but I would say the north may have access to some of those innovative startup companies that are coming down the track, where down south we have a relatively small number of, I guess, really scalable, innovative startups in the oncology space, therapeutic space.
Okay.
Relatively small number. So certainly I think the All Ireland Cancer Initiative does resonate with companies. A connected ecosystem resonates with them as well. Obviously, as I mentioned, we have to have the structures in the background to deliver on it, you know, that it's not just talk. But certainly, I think the concept of a connected system that crosses both north and south, and the opportunities and diversity of perspective that brings, I think, is a unique selling point to what we would bring to industry.
Yeah, that's helpful, thanks. And Liam has mentioned cross-border training, such as genomics here, team welcome ICAT. In terms of an APC spoke, obviously we need to think about that more, but we have a whole range of PIs, including some young PIs like Beth Brint, who's here in the audience, Neil Hyland, Susan Joyce, and Aileen Houston, all of whom work on cancer. So we definitely have the bandwidth to think about a deeper relationship with industry and AICRI to try and leverage some of these ideas. So that's helpful. Thanks, Seamus. Yeah. Jochen, you want to get in there?
I have issue with my mic today, sorry. I have just read this chat. So I just wonder, after, you know, Claire's talk and, you know, the preparation phases for meaningful All Ireland collaborations, if something, a charity like the Irish Cancer Society wants to participate, or other charities, I just wonder whether we should not strategically use the AICRI START funding to now liaise with the Irish Cancer Society or with other charities to see how they see now where they want to be in 2 or 3 years' time, i.e. when, let's say, the AICRI funding is actually over. So should we not use this really as meaningful building steps towards, you know, areas, niche areas where we would have international strengths, where we would benefit patients, where we would have patient representatives involvement and so forth going forward. And maybe, because at the moment, I know Liam is leading the AICRI START proposal. It is pretty much, you know, a proposal which, you know, emphasizes the interinstitutional strengths and the collaboration opportunities going forward. But I think we should maybe use that time now, when we get the HUA, before we get the HUA letter of approval or whatever we get from the HUA, to maybe sit together, maybe also with the charities, with the patients, and see where we can develop something meaningful during this 2-year, 3 periods going forward, that can then later be in a more sustainable framework, funded and co-funded, and get attracted more funding from other agencies as well, or other European institutions. I just throw this out as a discussion point. Yeah.
That's a good point. And you'll have seen Liam contributing to the chat, saying that AICRI STAR proposal has a focus on precision cancer mechanism, but can be fixed on specific areas within that. Does anybody else want to come in on this?
Just Rosemary here as well. I'll just add, yes, that's a very good point, Jochen. And I think, yeah, that's what Liam and I are, and the group that we've tried to work on, engaging more with the cancer charities. I know we're hoping to have a workshop with them in June that was more with the cancer charities, maybe the, you know, the key ones, we'll say. But yeah, that's definitely useful. I think AICRI START, we're hoping, will start in September with the PhD students and the postdocs. So we have the next few months when we're setting it up. And yeah, but I would agree that the cancer engagement with the cancer charities is vital, as is with the patients as well. So thanks, Seamus, there for your presentation today. But yeah, we'll definitely, Liam and I we'll be working on it, and we must get committee meeting, an AICRI committee meeting soon as well. So hopefully we can discuss that there as well. Okay. Thanks.
Thanks, Rosemary.
Subrata has his hand up.
Sure. So again, this is kind of directed towards both Seamus Brown and Claire. You know, as we go into precision oncology more and more, and either genetics or immune markers or microbial markers, a combination of them, we of course realize that what we are doing is we are converting common cancers into rare cancers, because in industry generally don't like too much segmentation of their market. They're prepared to tolerate some of it, but they don't like it to be fragmented into rare diseases, which has got astronomical drug costs. But there is a learning for charities and learning for industry as well here. And the best example of this was a rare cystic fibrosis genetic variant, which partnered with the cystic fibrosis charity in the US and created what is essentially venture research. And as a result of that, because the drug was marketed at becoming very rapidly at that time the most expensive drug. There are now other rare diseases that have put even more expensive drugs. They gained close to $1 billion in royalty from the industry because the charity was a partner of the industry in a kind of venture project, And so there are some kind of interesting things to look forward, and we talk about in terms of precision oncology, where we must be prepared for that because cystic fibrosis societies in the US, that their strength was they knew where all these rare cystic fibrosis patients lived, and it will need a fair bit of managing government regulations about privacy. But on the other hand, these genetic variant patients of segmented by the cancer precision or microbial variants or immune variants, these patients can't be readily recruited easily unless you know where they are, or unless you have a massive database. And I think the charities can actually partner with industry in this. And this is just a comment. I think we are not quite there, but we'll very soon be there.
I'd agree with you completely in terms of the, I guess, lifeblood of future precision medicine development is going to be patient data, both phenotypic, genomic, proteomic, anidiomic data that's there. I think it is a challenge around how do you aggregate that data in a way that's responsible, I guess, patient centered, and equally can enable innovation. I know that in another field, neurology, we've a program that is looking at a blockchain-enabled patient permission system to effectively build a system that would use blockchain technology for patients to permission how their data is used for research purpose. And I think with a view to giving back some benefit back to those that contribute their data or put their hand up for participation in clinical trials. I do take your point around as well precision medicine. It's funny in some respects. You often think of it being a market of one. To some degree, if you get really pedantic about it, it's very specific and personalized to the patient. What I would say though is that many companies are interested in not seeing their drugs fail through phase 2, phase 3 clinical trials, and that's where I think they're particularly interested in the stratification and really understanding the patient cohort they need to target, certainly when they start to bring the drug to market the first time out. And I guess the final point is that they're very interested in, when it comes to compensation or reimbursement for that drug product when it's on the market, the identification of the cohort of patients that's going to be most responsive to it, because generally these therapies are expensive and payers want to know what cohort is going to benefit from them. So it is true that the more sophisticated our patient stratification technologies get, the more we move away from potential blockbuster drugs. But to some degree, I think there's benefits that certainly from a point of view of preventing clinical trial failure from, I guess, enabling, I guess, evidence-based reimbursement discussions. I think pharma are certainly still interested in the work. I don't see anybody walking away from the activity.
Okay. That was really helpful, and we seem to be petering out in terms of questions, and we got 10 minutes left, and I have a firm stop at 2 o'clock, and I'm sure you all have loads of things festering unattended. So we've got 10 minutes. Jarushka, Subrata, and I are trying to wrap it up and discuss the next steps. To me, it's been a great session. I learned a lot, as always. I thought that the opening session, for me, the highlights, there were many. I enjoyed the basic research. I shared Donald Brennan's frustrations about issues like biobanking governance. I really understood Austin Duffy's, I won't say complaints, but struggle to manage platforms for setting up clinical trials. I was really taken with the number of trials you can do over the course of a career and the benefits you can bring to bear. I'm not overlooking the basic science efforts from Joanne and the other speakers. We didn't talk about stromal cells and heterogeneity of tumor samples, which drives me crazy because I look at the microbiome of different parts of a tumor, but I don't really get down to fine detail of what cells I'm looking at. In the session which I was involved in, we saw some great groundbreaking research on prostate cancer microbiome. Ken did his thing, which is really excellent basic science on innate immunity, and he segued from IBD to cancer and some really nice stuff. And then Joachim blew me away with talking about immunophenotypes and microbiome phenotypes, which straddle all kinds of cancer. And then we had a really nice overview of the funding landscape, the incentive for bringing IP to bear, an IP awareness. I was impressed with the statistic that 75% of PIs in RCSI are innovation active. That's a brilliant statistic. Claire told us about the mechanisms for charity funding and nicely introduced the necessity and the benefits for PPI. And then Seamus gave a very compelling personal story, but also a very robust, dispassionate presentation on how a research application can benefit from the patient perspective, which I think will resonate deeply with most of us. So our mandate is to try to bring this all together in some coherent way, to go back to Liam and the AICRI and benefit from this workshop to roadmap ways that we can all as a community of researchers benefit from the opportunity of this platform. Some of those opportunities I think are reasonably obvious, and I've tried to draw them out as the meeting went on. But I invite my other co-chairs to comment on their take-home messages and what they think we learned from today's workshop.
Well, thanks, Paul, for that superb overview, taking us through the highlights. I think, distilling it, the take-home messages down to maybe a top 3 from the sessions that I heard today. Some of the priorities that were articulated were, first of all, to focus our efforts within the pillar of immuno-oncology and the microbiome into 2 to 3 high-impact areas, since we're a small country, and to make sure that we focus our efforts in those areas, taking into account the landscape of immuno-oncology and the microbiome internationally. The second is to create a critical resource, leveraging the expertise and the interests of all the members of the participating group today to create a national biorepository that is well annotated and, as Donald Brennan mentioned, has the appropriate governance to allow us to interrogate the questions we feel are important. And lastly, to echo some of the sentiments I brought up, Austin Duffy and others, to create, and of course Claire's great point, to create that critical link between basic science and clinical researchers to be able to translate preclinical discovery, which is what many of us actually trained in the best institutions to do. So I think we should focus on those areas within this pillar, and of course the bigger picture, actually making it happen. And that's what I think the last section is critical to think about. We can do nothing without funding, and we can do nothing without the patient voice, because it doesn't matter if it doesn't benefit a patient. So I think we have to put it together in this way, and hopefully Subrata will have some further insights to add.
Subrata, and then Claire wants to go in. Subrata, have you any summary comments?
So I think I think it has been beautifully put together by Paul and Zerushka, and I'll especially thank Zerushka for spearheading this workshop, which was fantastic. The only thing I would add to it is that the entire program brought together how joined up we are, and how joined up immuno-oncology is with a microbiome and microbial science, and essentially we often talk about what microbiome is going to deliver for patient benefits frequently, and if there is any field where it is virtually at the cusp of delivering, if not already starting to design ways to deliver, is this area. And I think this is a great advantage to us, because we are potentially leaders in both the immunology of cancer and the microbiology and microbiome in cancer and therapeutic delivery. And this should be a magnet for industry, and this should be tremendous excitement for charities. And I think we can crystallize this into action points that make us really lead in this area and deliver. That was my take from this one. So I was very, very enthused by the whole half-day program.
Thank you, Subrata. That's excellent. Claire Gardner, would you like to come in, please?
Yeah. Just briefly, firstly, to say thank you. I've really enjoyed the session, and it was really nice for me to be able to see there's some things, for example, going on in the APC with Ken stuff and the interferon gamma and the innate cells that we should probably definitely talk and maybe think about that. But also, I can see potential for, with the prospective trial going forward, how the microbiome people can work with the immunology people potentially, and I think that's amazing to see as well. And for Austin, I really also appreciated, and identifying that missing link, because that's something that us scientists really, really would value very, very much. So if this group were even available again at some point, I think it's a lovely group and very promising. So thank you all.
Thank you, Claire. That's very helpful. Very nice comments. And I see Ken is reaching out to you on the chat. He can't help himself. Jack Stat. Okay. Are there any other comments? The recording of this will be available. There's presumably a circulation list, but you can Google each other and fall in each other's arms electronically, but wearing masks, and move things forward. We will go away and summarize this, talk to Liam, and we will develop ways to have a platform whereby we can all benefit from this as we participate in this All-Ireland initiative. So I'll sign off here, and I reiterate thanks to Zerushka, who actually masterminded the whole thing. So any credit for how well this worked is entirely due to her, Subrata, not me. I was the poor respondent.
Okay, everybody plays their part. Thanks, everybody. It was great to see you all, and we'll hand you back a minute of your time. Take care. All the best.
Bye.
Bye. Thanks. Bye.
Thank you.
Thank you.